As compliance officer, I'm presenting this material to the board of directors who are employed here in this hospital regarding the moral right to health care. The word moral can be defined as the study or general understanding of what is right and what is wrong. In this particular hospital, it is suggested as a moral or ethical act of conduct to provide individuals with efficient health care rights in the process of medical procedures. The term right is defined as what is accepted or what is considered to be morally good. All employees of this healthcare facility are expected to perform actions that are right or considered ethical. For some individuals, it can be considered a cruel or unusual punishment to not provide access or to deny services from the hospital or emergency healthcare department. Although one can only receive these services or products if they pay out of pocket through insurance coverages or services that are financially compensated by the government. However, it is mandatory that patients admitted into this healthcare facility obtain fair access to any emergency treatment or medical services. The code of ethics can be defined as a set of guidelines, ethical codes, or a moral standard of conduct that is practiced in this healthcare facility. Many different ethical organizations and team members work together to monitor, motivate, and assist certain behaviors to identify and set examples of correct moral values. HIPAA is defined as the Health Insurance Portability and Accountability Act of 1996, which was signed by President Bill Clinton. HIPAA rules were developed for the purpose of securing the collection of data concerning the patient's rights to privacy of their medical files, condition, history, diagnosis, and or treatments provided. Both HIPAA laws and the American Nurses Association has accepted certain codes of ethics concerning nurses. Those guidelines set examples of nursing responsibilities and role recognition in compliance to the specific codes listed in the handbook. Medical malpractice or particular acts of negligence is defined as when certain healthcare treatments or services provided do not meet standards or are considered to be provided at a low or below standard level in compliance with ethical healthcare laws such as HIPAA. Good moral values can also result in quality improvement in performance. In some cases where medical malpractice occurs, patients may obtain a more serious illness or even death due to the improper treatment of unethical services, products, purchases, or procedures performed in this organization. Often when medical malpractice acts are performed, liability levels increase and changes of successful outcomes decrease for either or both the medical professional or the organization. Healthcare resources can be defined as any funds, team members, personnel-related facilities, or materials that are used in the process of healthcare or a medical procedure. The term allocation is also known as the process of dividing or distributing healthcare expenses or income within the organization. When resources are allocated, the most moral, ethical decisions are made concerning budgeting, cost, or sustaining productivity in the healthcare industry. Resource allocation is how healthcare and healthcare funding is distributed among this hospital. It is important that this hospital continue to maintain a balance in costs or expenses in addition to managing income